basically intravenous therapy, IV stands for intravenous, is the ability for us to be able to deliver a mega dose of vitamins or minerals into the bloodstream, bypassing the digestive system. And that sometimes is important because we have a lot of patients that actually come in with, for example, digestive issues where they cannot absorb the nutrients that they're taking, even if they have an incredibly good diet, or that they have been experiencing chronic disease where it's been a long process and they're incredibly depleted. So one of the quickest ways to deliver nutrients and help a person gain health back quickly is through IV therapy. So the difference between having IV therapy here versus, say, somewhere in Las Vegas where they have a lot of the fancy IV lounges with a menu of IVs is that we are very aware and discerning about the type of IVs that we provide our patients. We listen very carefully to the condition and situation that they're experiencing, and we target the nutrients, the amount, the dosing, the types of ingredients, if you will, that we put in there to be very specific for them. So each individual is not necessarily the same. The comparison between having an IV at a naturopathic clinic like SCIMEDICA versus a Las Vegas IV drip lounge would be comparable to going to a general health food store, picking up some, multivitamins and, having that in a more smaller dose, a more general public dose versus a very specific ID for whether it's to treat and improve the immune system, whether it's to help the healing of chronic digestive issues, or whether it's for addressing autoimmunity. We're very specific when we give an IV to someone, and we don't encourage IVs for every single person that comes through the clinic. It's not something that every person that comes to SCIMEDICA must have. It's very specific, and it's a discussion that we, the doctors, will have with the patient to assess and deem as appropriate before we move forward.